Hi all, you're listening to Discover Your OT Path. My name is Riley Heiser and I'm a student at IU Kokomo, currently enrolled in the Occupational Therapy Assistant Program. For my capstone project, I'm creating a podcast to help current students learn about the various settings available to them. Today we're diving into the setting of outpatient oncology rehab, and then also this episode's a little bit different where we have somebody who has worked in hospital, long-term acute care, and rehab hospital along with the oncology rehab. So it's going to be kind of like a compare and contrast and just talking about the two jobs. So I'm excited to be joined by Jennifer Negron.
Hello.
Also known as Jen, was one of my professors, and she is currently a COTA. So before we dive on in, can you just tell us a little bit about yourself?
Well, I've been practicing for 20 plus years as an OT assistant, and now I am in the teaching world as an OT assistant, but I still get to do outpatient care, oncology rehab, and lymphedema on Fridays. I'm married and I have 2 kiddos and 5 goats, 2 dogs, and a cat, and I'm just working in the best profession in the world, so that's me.
All right, so describe the different workplaces for us.
So hospital versus outpatient is where we're going, right? So acute care hospital, you are working with people who are not medically stable. We're just waiting for them to be stable again to get them to that next level of care. So if they are stable, then they can go on to like a rehab unit where they get intensive therapy. They get 3 hours of therapy a day, so that's usually 90 minutes of OT. But if they're not stable, they might get sent to what's called a long-term acute care hospital. If they have lots of medical issues that need to be resolved, they could be there for 30 days. So I've worked in all 3 of those settings, and I've also I currently work in outpatient lymphedema care, which is oncology for the most part. I work with breast cancer, head and neck cancer, and maybe some pelvic cancer clients, and then some people that just have lymphedema for other reasons on an outpatient basis. And what was the question again? Describe that workplace. I enjoyed all of those workplaces. There is acute care. Some great things about it is that if your client can't participate that day because they're not feeling well or they're not medically stable, then there's no pressure to have to push them to do things that they don't want to do. Although it is important to get them up and moving, there's a little less pressure in acute care versus acute rehab hospital where they have to get their therapy in. So that is sometimes if someone's not feeling well, you kind of feel bad that you are pushing them really hard. But then you get to see in acute rehab hospitals how much they can improve really quickly. So that's really rewarding. You're using a lot of your skills to problem solve because they just have to get independent again. And so it's very rewarding to be in acute rehab. As far as outpatient care, one thing I always say that's great about it is that if they don't want to do therapy, they don't show up. So you're getting people that are motivated to be there, that want to do the therapy. And then you also are getting a population that is expecting more. So they drove there to see you. So I kind of keep myself humbled and keep my skills up to par because I have to remind myself that somebody actually got up out of bed and got in their car and drove here to see me.
Yeah.
Versus in the hospital, you show up in their bedside whether they want you there or not. So it's a kind of a different feel. But I've definitely enjoyed all of those areas.
Yeah. Would you say that, like, the energy is a little different, like it's maybe quieter at outpatient rehab or quieter in the hospital, or do you feel like it's kind of chaotic everywhere you work?
It would be quieter in outpatient rehab versus in the hospital. In the hospital, you have the beeping IVs, and you have ventilator alarms going off, and you have people in and out of the room interrupting your therapy session a lot. That sometimes could get frustrating because you feel like you finally get someone, they're finally available, and they're not getting an x-ray or an MRI, and nobody's drawing labs on them. You finally get your opportunity to get in there and start doing some self-care training, and somebody comes in and they need something.
Yeah.
So you have to be really flexible as far as that goes. But again, there's not really pressure to have to see them. You're just trying to get enough of a therapy session in for you to get an assessment of if they've made progress, where they need to go next. So it can get maybe a little overwhelming if you tend to not focus well with lots of noises and beeps, but you get used to it, and then it's cool to be able to push someone down the hall even though they're on a ventilator and you have an IV pull, and you just get acclimated to it, and then you kind of feel like, yeah, I can do anything.
Yeah.
Whenever you get someone moving that's on a ventilator, or get someone out of bed that's on a ventilator, or you're the first one to try things with them, and you're the first one to get them in the shower, and they love you forever. So you really are giving them freedom. Sometimes I would take them outside after they hadn't been outside in a month. And they really appreciate that. So you really get some cool moments working with people in the hospital. And then you also get cool moments seeing people in outpatient. You just don't see them as often. There's a couple days in between their visits. So you have to really push them to do more on their own, and then follow up after a couple days have gone by. So you don't have as much control of what they're doing and whether or not they're participating when they're outpatient, and then of course they could not show up or stop coming.
Yeah.
And so that's different. It's just a different feel.
Yeah. You had mentioned that, like, getting people out of bed, there's lots of tubes and everything.
Mm-hmm.
So do you have to do that by yourself, or do you work with others around you?
It depends on what you feel comfortable with. Most of the time, if there is a lot, if they're pretty medically, it's a medically intense situation, you would have a co-treat with physical therapy, or maybe even speech therapy. Anytime I needed someone, I would just put the call light on, and the nurse would be right there as well. So it's not a good idea to do all those things by yourself to start out, because you need an extra set of hands frequently. But then it's cool to have your bestie PT co-treat with you. Those are some of the strongest relationships I've built in my life. Like, my current best friend is a PTA that I used to co-treat with all the time, and so it's really cool to build that relationship with that person that is also there to help you. You really feel like you're a team at the bedside, and then there are times where I would just want to go by myself because I really want to hone in on some specific OT type activities, and that's fine. When the person is getting a little bit stronger, then you want to separate from that co-treatment, and you can handle them on your own. So it always just depends on the situation, depends on the patient, and what you're trying to achieve.
Did you ever co-treat at the outpatient, like, lymphedema clinic?
We usually don't co-treat an outpatient because you can't bill for, we're more unit-based, and you're supposed to be billing for the time that you're with that person, versus in acute care, that cost is built in to their stay. Mm-hmm. So occasionally there would be co-treatments, or if I had a cancellation, I would go in and help the other therapist in outpatient. One thing about outpatient is if you have a cancellation, then there's no patient to fill that time with usually, so you have open time. Even though they will book me 100% full, I'll get a cancellation and I might be sitting there for like an hour. So that would free up my hands to go help someone else if they need some extra hands. But we were always helping each other, and in between patients talking to each other and supporting one another. Of course, I have my supervising OTs that we work as a team, and and I never feel like I'm alone in any of the settings.
That's good. Hi guys, we're going to take a little break from the interview, and I'm going to ask an MBCOT type question. An occupational therapist is treating a client in an inpatient rehabilitation unit. During lunch in the hospital cafeteria, a nurse from another unit asked the OT about the client's diagnosis and progress because the nurse heard the case was interesting. What is the most appropriate action by the OT? A. Share general information about the client without using their name. B. Provide details because both professionals work in the same hospital. C. Briefly summarize the client's condition without discussing identifying details. Or D. Decline to discuss the client in a public setting and explain that the client information can only be shared with professionals directly involved in the client's care. And the correct answer is D. HIPAA requires that protected health information can only be shared with individuals directly involved in the client's care in appropriate private settings. So D is correct because the nurse is not involved in the client's care and the cafeteria is a public space. A and C are incorrect because even limited or non-identifying information can violate privacy. And B is incorrect because working at the same facility does not automatically grant access to PHI. Without further ado, let's get back to the interview. It sounds like you really loved working for any part of the hospital, and you love working at the lymphedema or oncology clinic. Mm-hmm. But as amazing as your setting sounds, nothing can be perfect. Mm-hmm. So what are some of the biggest challenges that you face in either of these settings?
In acute care, I would, again, get frustrated as trying to find that perfect window to actually get in front of that patient and be able to accomplish what you want to get accomplished, because they have so much going on medically that's the priority, and therapy is lower on the totem pole as far as priorities. So I did find myself getting frustrated with not feeling like my time was valuable because they were being taken away because they had to get an x-ray or whatever. But it is important to diagnose them appropriately and get their medical treatment accomplished first. And then once they are better, I would send them off to like an acute rehab facility. So as soon as they're getting better, they leave. Yeah. And you don't really get to see the outcome of that. But if you work in the actual acute rehab hospital, then you get to be there for all of that. So when I was in acute care, I did eventually move into acute rehab because I wanted to see that part. I was getting kind of bummed that as soon as I got them better, then they'd go somewhere else. And so that's why I went into acute rehab. Acute rehab is pretty intense physically for you. Your day is booked 100%, and because they are trying to get you to see as many patients as they can, each patient needs 90 minutes, so you are booked. It's hard to find time to take a break to go to the bathroom, because as soon as you're done with one patient, you're on to the next patient, and you have to be very conscientious of time and making sure that every minute counts. That made me really, I got really good at being on time after working in rehab hospital, because I was always watching the clock. So that is, depending on your personality, that you might thrive in that environment and love things to be structured like that. Yeah. There's a lot of structure in your rehab hospital type environments. But some people like a little bit more laissez-faire. And so I like that about outpatient. I have more control of making decisions as far as like when someone should come back again and how long I want to spend with them. For the most part, I get to make those decisions. And not every minute of the day typically is accounted for. Although there seems to be more paperwork in the outpatient world because we have to be working with insurance to get pre-authorizations. And in your acute rehab and your acute hospital, there's not as much of that, less paperwork in hospitals.
Yeah. If you had a really tough day, was there anything that you could do that helped made it easier for you?
It's always about mindset, being grateful for the moment and being grateful to be in a position to be helpful for people. I like to joke around a lot and post little jokes and puns on the board for other people to read at work, and the patients really like that. So I think just try to keep your head, not overthink things. Don't let yourself get into like an anxious tailspin, and just remember that you just never know if what's going to work and what's not going to work. So try to keep it light for the most part. And I think that applies across all settings, is that you do the best that you can, keep a positive attitude. And I'm just always grateful to be in a profession where I get to work with people every day. I really enjoy getting to know them and just kind of digging into who they are. Everyone's like a puzzle. So if you really truly embrace getting to know people and learning about them, your day will go by so fast. It won't feel like work.
That's fun. If you could just pick one thing from each setting that is your absolute favorite thing, what would you choose?
That's a good question. Acute care, I really like the variety. There's just so many things that come across your path and it keeps you on your toes. And there's flexibility. I love the variety and flexibility in acute care. Long-term acute care, I really liked seeing people who were really, really sick come out of it. Like just watching kind of these amazing recoveries. With that on the other side, not everyone recovers, but just seeing people go through some really horrific medical events and then survive it and then rebuild themselves is really rewarding. And getting them to take them to the shower the first time, just being that person that takes them to the shower the first time, they love you. And it's just it feels so good to make someone feel good in that way. And then outpatient, I don't take people to the shower, but I do give them I help them, I think, to be seen in the cancer journey. It is very complicated and it's a very difficult time of their lives. And so just being that listening ear and validating how they're feeling and giving them a path forward, they really appreciate that. And just that feels really good, to make someone feel better after having faced cancer.
Yeah, I bet.
Yeah.
What is something that people on the outside might not expect when working in these professions?
And I know that when you go to school, you're like really excited to go out there and help people. And then you get into that daily grind. And you might be surprised that you got really excited to get out there and do it, and then once you do it, you've done it for a month or 3 months, and then it starts to be a routine, and then you start to get like, I don't want to do this.
Yeah.
I think that might surprise people, and I think you have to work through those feelings and stay motivated, because in school, I think you have to stay motivated to, I don't want to do my assignments, but you do them anyways. So you really have to find your why and stay connected with that so that you don't become kind of negative Nelly. And you really do need to bring your best self to help these people to be effective. So you will get to a point where you feel burnt out. So you'll have to find some good self-care techniques in order to keep yourself focused on the big picture in those situations.
Yeah, that's going to be really helpful.
Mm-hmm.
So for any students or any listeners who might be considering a similar work career or like a work environment, can you give me like 3 traits that you think would really help them fit in these different environments?
Curiosity.
For anybody listening, that is her favorite word ever.
Yes, always stay curious. Because when you're in your curious frame of mind, you're not in your judgmental frame of mind. It's really easy to judge people, and instead I really think you just should stay curious, because they might be really mean or might be really grouchy or even smell bad, right? It happens. So stay away from your judgmental frame of mind and get into the curious state of mind, into what's going on with them. Dig deep into what you can do to help them, instead of being judgmental and kind of grumpy about it. That's a very important quality, I think. Mindfulness is important. Just be in the moment. And we tend to start to get really nervous about our caseloads and say, oh my gosh, I have 12 people I need to see today, and it can be overwhelming. And I've done that many times, and I was like a complete grouch because I had this caseload that I was really nervous about, and then at the end of the day, about 4 or 5 things fell out, and it turned out fine. So staying in the moment and not trying to project in the future and stress over what might happen throughout the day. You could just, be there, be in the room with that person. That's really what they need, is just for you to be there. You don't have to stress out about doing the perfect activity and making sure that they achieve this goal in a perfect way. If you are just being there, it will come.
Those were all really good.
Yes.
So before we finish up here today, is there any advice or anything else you'd like to share about the work setting or like the experiences you've had?
Just keep learning. Be a lifelong learner. And that is, you'll get out there and you'll start to notice that you don't know something about an issue, and just follow your questions as far as, okay, I don't understand this, find a way to learn more about it, and that will keep you fresh, because we get new information every single day. The profession's constantly changing, so you have to keep up with what's going on. So that means you're joining the professional organizations, you're going to conferences, you're reading articles. And the more you do that, the more you'll find that you're more effective if you're keeping up with what's going on and what the new techniques are. And then that keeps you more excited too, because you're always trying something new.
Yeah. All right. Well, thank you so much, Jen, for letting us know all about these different settings that you had worked in, and currently work in. We really appreciate you being here.
Okay. Thank you for having me. It was fun.
And thank you so much for listening. Be sure to follow along for the next episode, where we'll be learning all about driving rehab.